Welcome back to See, Hear, Feel. Today I'm very excited to be speaking with Dr. Timothy McCalmont, Professor Emeritus of the Departments of Pathology and Dermatology, University of California, San Francisco. He was co-director of the UCSF Dermatopathology Service for 25 years, as well as the editor of the Journal of Cutaneous Pathology, which is one of my favorite dermpath journals. His BS in biochemistry and MD are from Iowa State University. Medical school he attended at the University of Iowa College of Medicine. His residency in anatomic pathology was completed at Wake Forest University Medical Center. He subsequently started residency training in dermatology at UCSF, where he did his dermatopathology fellowship training as well. He is internationally renowned for his diagnostic skills that span the breadth of dermatopathology. Recently, Dr. McCalmont has moved into a new role as a dermatopathology consultant in the private sector at Golden State Dermatology Associates. So welcome to Tim.
Thank you.
Today, I'm going to cover a broad range of topics with Tim. And my first question is, what does emotional intelligence mean to you?
Let me say at the beginning that I am not an emotional intelligence expert, even though I've had people tell me that they think I'm emotionally intelligent. Broadly, I think we just want to be able to understand what we're feeling and regulate what we're feeling so that our day-to-day interactions with trainees, colleagues, people we meet at the market are predictable, fun, and rewarding.
I am also by no means an expert in emotional intelligence. And because I'm no expert, that's why I've really started to try to delve into what emotional intelligence can mean for us as physicians, as dermatopathologists, as pathologists or dermatologists, or really any kind of physician. For me, not that my family life when I was a kid was unpredictable. It was pretty predictable. We just never talked about emotions. We just never showed them. Emotions underlie our decision making. And even if you think that they don't, you're sort of deceiving yourself. Antonio Damasio has shown that emotions actually are there in every decision we make. That's why I got really interested in making sure that I at least had some sense of how my emotions might be affecting the important decisions I make at work, especially meaning the diagnoses that I make, because every diagnosis is a decision. That brings us to actually metacognition, which simply defined is thinking about thinking. I wanted to ask Tim what metacognition means to you.
Broadly, metacognition is understanding how you yourself learn and how you yourself perceive the world. I've spent a lot of time thinking about how I learn and how I perceive the world, how I perceive the information within slides. You want to find yourself in a situation where you're seeing imagery and you use that to infer a diagnosis. And then when you find yourself back in that same spot, you do exactly the same thing. You do not want to be in the situation where one day that leads you one direction and another day that leads you in a different direction. That's what I would think of as sort of emotional diagnosis. I want to be in the situation of just seeing that thing and then seeing it again another time and recognizing it. As part of that at work, I try to be relaxed and non-emotional because I think that's the proper framework to be permissive, to being able to see things and understand them and then see them again at another point in time and come to the same conclusions. The method is being in the same mental framework to be able to make the same diagnosis at different points in time.
I think it's interesting that you put yourself in the proper frame of mind or maybe frame of mood because you kind of want yourself to be calm. It sounded like you were saying when I spoke to David Caruso, he mentioned a mood meter or a mood map. He says you can grade yourself on level of activation, like very low or very high, and then level of pleasantness, very low or very high. For me, when I'm doing something important like diagnostic work at the scope, I do want to be more in that sort of middle ground. I don't want to be like depressed, but I don't want to be so elated because if I'm super, super happy at that extreme, but also very, very down, in neither state can I really be very focused. How do you continuously improve and learn while keeping that kind of predictability?
when we do pathology, when we do dermatopathology, it's a little bit doing it in a vacuum. The diagnosis is the diagnosis because I said it's the diagnosis. And that's fine, but that's really a bit shallow. So what we need is we need to have an external way to measure our diagnoses. That can be through colleagues. So using ancillary testing for me personally was very valuable by being in a situation where I got to compare my diagnoses to molecular diagnoses. I underwent an explosion of learning. And I think it really enabled me to grow in a way that I hadn't previously imagined, both in terms of confidence in what I was doing, but also in terms of, sort of a form of self-validation.
I love that answer. I love what you said for several different reasons, but the first is when you talked about the explosion of improvement that you experienced with having the molecular to be able to compare your diagnoses to. That's that's awesome. And I think it speaks to a concept in cognitive psychology that was developed by Dr. Anders Ericsson. His term was deliberate practice. We can do something like read a slide and come to a diagnosis. And the way to get better would be to set a task for ourselves where we have an end goal and kind of a way to compare ourselves to, are we really getting better? And so I think with the molecular, it gives you, or maybe comparing yourself to what an expert might say, it gives you that feedback of whether you're right or wrong. If you choose to always believe the expert is correct and you're not, or if you choose to believe the molecular is correct, all the time, that it just gives you a means of feedback. And feedback is necessary in that deliberate practice model. Another psychologist, Christopher Chabris, calls the illusion of attention, where we think that we have, or we hope, I guess, in TermPath at least, we've seen all of the important things, all of the important features, all of the important data points, as you mentioned in a slide, but we might be missing something significant. Christopher Chabris calls that the illusion of attention, where we think we're seeing everything we need to. He was one of the originators of a very famous experiment with a gorilla and basketball passes. I don't know if you're familiar with it.
I am.
Have you ever experienced that so-called illusion of attention, or the psychological term is inattentional blindness, where you thought you saw everything, but then you realize you actually had not?
I think if you're actually paying attention, you can find ways where you see that happens to you all the time. When people ask me what I do, I tell them that my job basically is facial recognition. Like, for example, as humans, we're very good at facial recognition.
Yes.
But we can see somebody when they're in a still photograph and sort of understand what they're about. But if we know them well, we can actually recognize them when they're running and sweaty, when they're driving a convertible with their hair blowing, they've got a bicycle helmet on. We can recognize them in all their different things. I think with molecular feedback, I'd like to think that's what I'm doing when I recognize Spitz nevi. So I can recognize a Spitz nevis that has a bad hair day. I can recognize a Spitz nevis that is in a strong breeze, because once you get a feel for this kind of thing, you really sort of understand it in a way that's difficult to explain, but you're like, oh yeah, that's that thing again. With respect to human faces, we've all had the experience where you're walking down a hall and you see somebody at the end of the hall and you think it's somebody, or you're walking down the hall in the airport and you see somebody at a distance and you think it's somebody. And you might even sort of be tempted to wave and call out to the person, but then you get closer and you're like, oh, it's not Christine Coe. It's somebody else. I'm so glad I didn't say something. And so you can have that kind of thing happen in work too. So you look at a case quickly. I actually had it. I knew I looked at the case quickly, so there was no penalty for it. But I wanted to decide if I needed to order a stain before I left work. So I looked at a case very quickly, and I thought, oh, that's a nevus with neural differentiation. And so I actually went and talked to a colleague about whether or not I could do an EMA stain, because that was a stain that was undergoing some additional validation. And so I wanted to understand if it was available or not. And the whole reason I wanted to do that was because I wanted to know if there was perineuromatous differentiation in this possibly neural nevus. Then I got home and I looked at the case again because I had a little time before my wife got home from work. I recognized that it was completely different than what my glance had told me. So I think what we want to do diagnostically is sometimes the inattentional blindness can be because we just do something too fast and we shouldn't do that. Sometimes it can be because we have sort of preconceived notions and we get off on the wrong foot. The way I deal with that is I do a lot of mental double checks. So especially if it's a complicated case, I look at the case and I sort of put together, but then I sort of look at it again with a different frame of mind. Is there any way the diagnosis could be wrong? And sort of re-ask myself questions about the case, so as a double check. A thing that I think is valuable, which is what I call the set aside. And so I'll look at a case and I'll come to sort of a preliminary impression, and then I'll set it aside, and I might let it sit, to the next morning. It might be many hours later, the same day, and then look at it again. And for certain cases, I might look at them with a set aside 3 or 4 times before I finally decide, this really is the best pathway, or recognizing that the decision is basically unknowable. So I think those are the kinds of things that can be done sort of as guards against inattentional blindness, so that you don't end up thinking you're talking to Christine Coe but embarrass yourself because you're talking to somebody completely different. So
I love that. No, that's very helpful. I have started to do some of what she said, actually, or a while back I have, but I started to look once and then actually look again a separate time and ask myself for each slide, what else could it be? And just make sure. So if even a basal cell, I'll say, okay, again, I looked at it. Now I'm looking at it a second time. I still think it's a basal cell carcinoma, but could it be something else? And what's the worst thing it could be? And make sure it's not. And for me, I think most of the time it's melanoma. I'm like, well, could this actually be a melanoma instead? But for blue tumors too, I'll sometimes think, well, also, could it actually be a Merkel cell carcinoma instead? Similarly, for each kind of diagnosis, I'll have other things like that. Well, what else really? What's the worst thing that this thing could be? And I'll just sort of check on that. But I love your answer. Do you have any final thoughts?
Well, thank you very much for having me. I think my main thoughts are just that we can understand ourselves as humans a little bit better, and we can use that to be able to make our professional life strong and vibrant. So understanding ourselves and putting ourselves in a situation to succeed, we can play to our strengths and make ourselves better physicians, better dermatopathologists by thinking about what we're doing. And your session at the ASCP this past year was valuable as part of that, because part of what we do, the title of the session for anybody that didn't see it is Thinking Fast and Slow as sort of an underlying theme. But I think that's important in terms of understanding how we do our professional work. Part of it is based on long-standing themes and ideas and training and experience. And then part of it is refining it with new concepts. And so we just have to recognize that it's multifaceted, the information that we're using. It's not just one thing. It's not our base training that is going to be true for all time. We have to be dynamic in terms of understanding ourselves, dynamic about the kinds of educational experiences that we acquire, and use that as a means of continual improvement.
Thank you so much for spending time with me. I really appreciate it.
Great talking to you.